Hello, today we'll look at unipolar depression, but with psychotic features. This is different. As we know, we have many types of depressive disorders. We have anxiety type, atypical type, catatonic, melancholic, mixed features, peripartum, psychotic, and seasonal. These are all unipolar depression, but with some coloring of a different subtype. So in this coloring here, we have psychotic depression. That means we have a unipolar depression, but with some features of psychosis also, because psychosis itself is another disease. Depression is another disease, but we have here unipolar depression with some kind of psychosis also. And the symptoms are delusions, hallucinations, thought disorganization, agitation, and aggression. Delusions mean that we have a false fixed belief. False fixed belief. It's a belief that is false and it's fixed. You cannot change it. I tell the patient that, no, but please, you are not on the moon. You are not on Mars. And he thinks that he's on the moon. He's completely fixed on this idea that he's on the moon. That's a delusion. So, for example, this patient is fixed belief that he is the king. You cannot do anything about it. Hallucinations, false sensory or auditory perception, meaning you ask the patient, do you hear anything now? Yes, I hear voices, but there are no voices here. Yes, but I hear it. So these patients hear voices and they see things that are not there. That's hallucinations. Thought disorganization, the thoughts are disorganized. They have not they have not a linear way of thinking, a logical way of thinking. It's completely disorganized, complete without any logic. Agitation, they're agitated. You can see it on them. You can feel it. They're agitated. Aggressive behavior. These are all psychosis. Okay? Psychosis with hallucinations, with delusions, with disorganized thoughts, with agitated patients, and aggressive patients. These are all psychosis. And how is it possible to distinguish then unipolar psychotic depression from schizophrenia? Because, as we said, we have three diseases here. We have schizophrenia is one disease, unipolar depression is another disease, and psychosis is the third disease. But we have mixed features of these. It can be, for example, in schizophrenia that we have psychosis in schizophrenia. We can have psychosis in unipolar depression, or we can have a completely pure psychosis. So schizophrenia and unipolar depression have to be distinguished somehow, because both patients had psychosis. And how do we know it? We do it in that way, that we know that we have a schizophrenia patient with psychotic features in the absence of a depression, because this schizophrenia patient does not have any depression. And then we know that this is not schizophrenia, it's depression. Okay, so that means that in order to distinguish schizophrenia and depression, we need to ask us, is this psychotic behavior with depression? Then it's unipolar depression with psychotic feature. Or is the psychosis on, so without any depression? Then it's schizophrenia probably. So then we have bipolar disease. Here we have psychosis, but we also have mania or hypomania. Then we know it cannot be unipolar depression, because this is called bipolar depression when we have two poles. We have a pole of mania, meaning increased activity, increased feelings of the patient, so they are feeling good sometimes, maniac behavior, or they have a really high depression. And maybe this patient is in the depressive part now. Meaning a bipolar patient can have depressive episodes, let's say 2 weeks of depression, and then they have 2 weeks of manic behavior. And let's say we meet this patient when he is in the depressive period. Then how can you tell that this patient is a unipolar or bipolar patient? You just ask, did you ever have mania or hypomania in the history? Or you look at the chart, did he ever have a diagnosis of bipolar? Or did you ever have a diagnosis of mania or hypomania? When yes, then he's not a unipolar patient, because unipolar means it's only one pole. It only means that it's only depression with psychotic features. And then we have to treat it otherwise. So here, ask about the mania or hypomania. If he says yes, or if the chart says yes, then it's a bipolar disease with psychotic features. If no, then it's a unipolar patient with psychotic features. So mania or hypomania. Good. Quick review. That was it. This was the symptoms. It's actually similar as psychosis. We have subtypes, as we said: anxiety, atypical, catatonic, melancholic, mixed features, peripartum, psychotic, and seasonal. We are dealing with psychotic today. The symptoms of psychotic depression being delusions, which are false, fixed beliefs. This guy thinks that he's the king, and it's impossible to tell otherwise. So you cannot really convince him otherwise. Hallucinations means that you hear sensory or auditory things. So it means you hear auditory things, or you sense things that are not there. So you are seeing stuff that are not there. And these patients can actually be really afraid of these things, because maybe the things that the patient hears is that kill yourself, kill yourself, kill yourself. And then this patient after a while will kill herself. And that's the problem. Or when the patient sees something, this is psychosis. He sees something. Let's say a patient sees that somebody is coming with a knife. What do? You have self-protection. So then this patient will then protect himself against this guy. But this was only a hallucination. This other guy didn't have any knife in his hand. That's a sensory hallucination, a visual hallucination. And therefore it's very dangerous. Psychosis needs to be treated. The symptoms also are thought disorganization, so no logical step, agitation, and aggression. These are all the symptoms of psychosis, and we distinguish unipolar psychotic depression from schizophrenia by seeing that in schizophrenia we have psychosis in the absence of depression. There are no depression in schizophrenia here. In unipolar depression or in bipolar depression, as we know, there are also depression. So schizophrenia, we have psychotic symptoms, but no major depression. In bipolar disease, we have mania or hypomania together, and then we can say that this is a bipolar disease with psychotic features. Anything related in the past to mania, bipolar, or hypomania is not unipolar. Please remember that. So ask for it. The anamnesis is the most important tool that the doctor have. Just simply ask the patients. Ask the patient about the previous things that he did. Did he buy a lot of stuff? Because this is hypomanic behavior or manic behavior. They buy a lot of stuff. They're really active. They're really loud. They're really disorganized and just too much for the society. This is a manic behavior. So thank you very much for listening. And I hopefully you know now what the symptoms are of psychotic depression. So not unipolar depression only, but we have a unipolar depression with psychosis. And these were delusions, hallucinations, agitations, aggression, and thought disorganization. So thank you very much for listening. Bye-bye.